Hello, my name is Dr. Chaitanya and welcome to my new YouTube video. Coming to the practical of female genital system, you have to supposed to write down all these things in your practical book. And coming to the first one is the benign tumor of the uterus, that is the leiomyoma. So leiomyoma is arising from the smooth muscle, so it is a smooth muscle tumor. You have learned this in the general pathology already. Again, this is the repetition for you. There are the two histopathological specimens for you in the laboratory. One is this one. This is the gross with the wet mount formalin preserved specimen of the uterus, and it's showing the fibroid, which is outside the uterus now, and already cut the uterus and stitched it back. So this measuring around 10 into 8 into 5 centimeter. The external surface is smooth with few congested blood vessels, and the cut surface shows solid, firm, well circumscribed, grayish white and whorl appearance. So please remember, there are the two things in the cut section. This one is the whorl appearance, okay, and the another one when it come to the fibroadenoma in the breast, so it is the slit appearance, okay. So these are the two things you should remember. When it is a slit appearance, it is in the breast, whereas in the whorl appearance, it is in the fibroid in the uterus. So if you remember these two words, that is the very important. You utter in the examination, you will get the full marks. So second one is this is a cut open uterus showing the many fibroids. This one is the one fibroid, this is another, this is another, this is another. So this is actually cut open uterus. If you cut open uterus is like this. The below line is the cervix, then above is the uterine cavity, and here you can see the fibroid. Coming to the next one is the CA cervix. I told you CA cervix is arising from the cervix again. So there are the two parts of the cervix. One is the ectocervix and another one is the endocervix. In between these two there is a one transitional zone. So this is the most common place from where this tumor can arise. So grossly also you can see that when this tumor is there, it will be coming out from this zone either on this side or on this side. So basically most of the time it will go to the nearest part, it will come to the external zone of the cervix. So this is formalin wet mount specimen of the uterus with cervix and the bilateral adductor, totally measuring around 11 into 8 into 4 centimeter, and the cervix shows large exophytic or cauliflower like growth. So please remember these words. This is the cauliflower like growth. Exophytic cauliflower like growth is seen here on the external surface of the cervix. So it is the specimen of cervical cancer. Coming to the serous cystadenoma of ovary, there are the two specimens in the ovary. One is the serous cystadenoma, another one is serous cystadenocarcinoma. These names are come because they are their arrangement under the microscope. Basically this is the epithelial origin tumor. So tumor arising from the epithelium, it is first thing. Second thing is cyst, and another one is adenoma. Cyst means it is a cystic. So cyst is lined by the epithelium first. Second is the adenoma, it is a glandular arrangement. So cystic and glandular arrangement of the tumor under the microscope, so it is the serous cystadenoma. When it is become carcinoma, these cells are not similar to each other and they show the malignant feature, then it is called as adenocarcinoma. Another thing is this epithelium will infiltrate the surrounding stroma, okay. So there is a surrounding stroma in the ovary. That stroma will be infiltrated by these cells and the glands, so it is called as the carcinoma. When it is not infiltrating, then it is a adenoma, okay. So it is a benign, and this is the specimen of benign. It's very simple that basically when you get the ovary for frozen, most of the time you cut open the ovary, and if water like serous fluid is pouring out, okay, it is coming out from this, then it is most probably serous cystadenoma. See, open it and you can see that there is a cavity. So this is a wet mount formalin preserved specimen of the cystic mass, measuring around 13 into 11 into 5.2 centimeter. The cut surface shows the cyst, and cyst is grayish white and variable thickness, and fine papillae are seen at some places. So this is the place where you can see the some papillary. Sorry for again the blurring of the film. So this is the cystadenoma. Another one is the serous cystadenocarcinoma of the ovary. Here again the specimen is formalin preserved wet mount formalin preserved specimen, with the uterus. But here the main difference is you can see the both things, that is the solid tumor and the cystic part. So partially cystic and partially solid is seen in the serous cystadenocarcinoma. Okay, so coming to next specimen, that is the teratoma of ovary. Teratoma may be of mature type or immature type. Immature type is more dangerous and it contains the neuronal part. Okay, neuronal part. Mature type again can be divided into many different types, but I am not going in detail. So here is the formalin preserved wet mount specimen of the ovary, which is showing the uncut section. There are some papillary areas, and hairs also can be seen here. So there is a, when you are opening this ovary, it will be smell very foul and the pultaceous material will come out. Okay, and the hair or teeth, you can get anything. You can get a thyroid also, you can get hair also, you can get skin also, you can get teeth also. So anything coming or covering our body, that is the external surface, actually coming from the ectodermal element, so that all ectodermal element can be seen inside this ovary, and this is called as the teratoma. So this is a formalin preserved specimen of the ovary, measuring around 5 into 2 into 3 centimeter, showing papillary solid areas and the hair. So this is the specimen of the teratoma. Thank you.